There was an article last summer in the New Yorker magazine, but you can Google it online and download it, called, excuse me, just a tickle in my throat, The Cost Conundrum, by this young surgeon from Boston named Atul Gawande. But Cost Conundrum. And Atul has written actually a couple of books and many thoughtful articles about healthcare. And he doesn't speak to healthcare reform, and yet if you read his article, you get it. And the kinds of things we're just talking about. He went to, well, he actually, the data was already available. He starts off by talking about the most expensive place for healthcare in the country. And you're thinking, well, it might be New York, it could be Boston, maybe it's Miami. No, it's Allen, Texas. And this is a county that's actually one of the poorest in the country. So he went to figure out why that was. And they're most expensive in the sense they use more healthcare services per person than anywhere else. And then he compared it to El Paso, Texas, which is a similar size county, several hundred miles away, same demographic makeup, same age breakdown, same ethnicity, roughly the same income levels, and it used half the amount of services. And oh, by the way, by every healthcare quality measure, had better quality health care than McAllen, Texas. Well, this gets at the very heart of the difference between a Mayo Clinic and a disorganized community of healthcare services where they're not sharing the medical information and so forth. So anyway, I recommend you read that because it really gets down to we need a more organized way of providing healthcare. I'm not saying the government should do it, but maybe the government needs to mandate that we must work together, that we must share our electronic medical records, that we need to coordinate services in a way that assures that we're using what we call evidence-based medicine. I don't want to shock you, but a lot of the healthcare services being provided in this country have never been actually demonstrated to work by blind research studies. That's right. And the Institute of Medicine has found that in looking at the latest research that has been done and proven treatments, methods of treatment, that those are followed in your local community, in our local community, across the country, only about half the time. And it's not because your doctor, my doctor, doesn't care. It's just an overwhelming, huge amount of information that's like turning on a fire hydrant that's constantly, thousands and thousands of articles are published every month. So the latest research and getting that in some organized way to your doctor's desk and into their head takes 7 to 15 years, and that's the transition period. So that we could do a much better job if we could just organize it a little bit more and make all the pieces tie together. So basing on evidence-based care, doing the right thing in the right order, based on the latest research, and focusing on providing health care prevention and managing diseases early would be huge.